Acne vulgaris is a disorder of the pilosebaceous unit. And what that means, pilo is hair and sebaceous is oil gland. And it's an inflammatory process. There are several underlying causes for acne. There's acne vulgaris, which usually is associated with the changes in puberty or hormonal changes, but they can also be pathological hormonal causes such as polycystic ovarian disease. They could also have an endocrine tumor. And therefore, if you see people who present later in their life with acne with no previous history of acne, it's very important to delve a little bit deeper into the history because they present with acne, but they may have an endocrinological problem that needs to be sorted out. Other things such as medications can cause it. Contraceptive devices can also predispose people to acne. So there are several things. One of the common things that people ask about, does food cause acne? So different foods do not cause acne, but they certainly can worsen acne. So things such as milk, which tends to stimulate IGF, which is insulin growth factor, that can cause a worsening of acne. Sugars can cause it as well, we all know that sugars have an effect on the insulin pathway. And again, it indirectly affects IGF-1, which is insulin growth factor 1 and growth hormone. So acne, it has several grading scales. The one I use is called the Leeds Acne Severity Grading Scale, and it goes from 1 to 12 for the face, 1 to 8 for the back, and I believe 1 to 7 for the chest. And the higher the number, the more severe it is. And what makes it more severe is the area affected. So if you have more of a certain, so if more of your face is affected, that is more severe than someone with a single area, such as a cheek or a jawline or a forehead. If the types of lesions also makes it more severe. So if you have non-inflamed comedones or blackheads or whiteheads for those, which is a common term for them, that is certainly less severe than someone who has deep, painful boils and nodules in the skin. The presence of scarring is the third thing that we look at, severity. If you have scarring, that certainly is not good. And we want to catch acne before scarring starts, or certainly while it's still early, because scarring is so hard to treat. And the final thing about what makes acne severe is the patient themselves and how they feel about the acne. So if this acne is affecting their mood, their ability to work, their ability to form relationships, then that is also considered to be severe. Yes, believe it or not. I know a lot of times, especially teenagers may go to their GP, and nothing against GPs. I love them. They're great. They're my colleagues. And, sometimes their acne may be dismissed because it's not thought to be bad enough. But acne can also be part of a systemic inflammatory condition. So you can have something called acne fulminans, which, if you think fulminans, that does sound explosive and volcanic, which is what it is. Lots of spots, they're very inflamed, they're very painful. You also have systemic inflammation, you have fevers, joint pains, bone pains, and that is severe, and that needs immediate attention with a dermatologist. And it's also associated with certain syndromes like Papa syndrome, which is pyogenic granulomas, along with pyogenic arthritis and acne vulgaris, or SAFO syndrome, which is associated with a bit of synovitis, acne vulgaris, pyoderma gangrenosum, hyperostosis, osteitis. And why I'm mentioning this, because you can also have resorption of the bone or osteitis with acne. And so, yes, it can require immediate medical attention. Right. So the previous questions certainly, have answered some of this. So how does acne affect the skin? It's associated with, sebaceous gland hyperactivity, but that is not on its own sufficient to cause acne. So you can have oily skin, one. You can have uneven pigmentation if you have skin of color. If you have skin of color particular, you can have a lot of post-inflammatory hyperpigmentation, keloidal scarring, which is, very hard to treat. They're painful, they're unsightly. and scarring in generals. And all of that, again, as I mentioned before, affects their relationships, their job prospects. So, you know, there are several effects that acne can have on the skin, but generally, if you wanted two bite-sized words, it's unattractive and painful and oil. Well, that's more than two words, but you know, oily. The most effective treatments for acne have to be tailored to the severity of the acne that presents to you in your clinic. And therefore, the less severe types of acne, we probably can get away with topical treatments. The mainstay of acne treatment, unless you're pregnant or breastfeeding, is a topical retinoid that helps to smooth the skin, that prevents new lesions from coming, that treats fine lines. It's great. So a topical retinoid has to be in the regime unless there's a contraindication to it. Other things that are great include benzoyl peroxide containing combinations. Sometimes it's combined with adapalene, or sometimes it's combined with a topical antibiotic such as clindamycin in well-known brands here in the United Kingdom, certainly. And benzoyl peroxide is very helpful in that it reduces not only inflammation on its own, but it also reduces resistance to treatment. It increases the penetration of these treatments into the skin. Benzoyl peroxide, therefore, is another hero ingredient. However, we have to be very careful. It's well tolerated at low percentages, but the higher percentages you go, then it causes more irritation. We have to remember that it causes bleaching. So that is for mild, even up to moderate acne, and those topicals can treat it really well. Once you get to moderately severe, we need to get oral antibiotics on board. For those who don't want to take any tablets, because you know some people don't want tablets at all, there are light treatments available, but having done research myself in it, and I have publications in peer-reviewed journals, they actually don't work any better than a bland topical retinoid, such as adapalene, but they are there and available for those who want light treatments. They do have positives in that they also affect collagen formation. They may also help with reducing general inflammation. So they're not to be thrown away into the bin, but I'm just saying, you know, don't bypass very well-respected and time-honored treatments to try the newest fad. And finally, if you have severe acne, unless there are contraindications, Roaccutane, isotretinoin, Accutane. So the drug name is isotretinoin. In the United Kingdom, it's called Roaccutane. That's the La Roche brand. There are others. And in the United States, the brand is called Accutane. And that is extremely effective. A lot of people tend to be afraid of it, but usually in experienced hands and with close monitoring, you will get a brilliant result.